Hey guys, my name is Ronald. I'm a registered nurse and also a family nurse practitioner. Welcome to my channel, Nurse Track 101, where nursing lectures are made easy just for you. Well, let's get started. Hello guys, welcome to my channel. My name is Ronald and today we're going to talk about thyroid hormones. Especially, we're going to talk about specifically about hypothyroidism and hyperthyroidism. We're going to touch on physiology, pathophysiology, and different diseases that were related to hypothyroidism and hyperthyroidism. So, yeah, let's get started. Let's talk about the thyroid hormones and its effects on the body. So, thyroid hormones. Yeah, the first function of the thyroid hormone is to increase the transcription of large number of genes. So, in this case, if you increase the transcription of large number of genes, you will have increase in functional activity throughout the body. So increase functional activity throughout the body, and this is caused by the transcriptions of genes inside the cells. The second one is the effect of thyroid hormones is to increase cellular metabolic activity. So increase cellular metabolic activity. The thyroid hormone does this. It does increase the cellular metabolic activity by way of increase the numbers and the activity of mitochondria. as you guys know, mitochondria in cells, they are used as to perform respiration. And if you increase the number and activity of mitochondria, it will also increase the cellular function. So in this case, it will increase the number and activity of mitochondria. The third one is the effect of thyroid hormones on growth. So it's really important because especially for children who are growing, thyroid hormones are really, really important. Such as, for example, in fetus life, thyroid hormone is very, very significant. It's very important for the development of brain in fetus. Also, skeletal growth, like in children. The fourth function is of thyroid hormone is in the metabolism of our body. So body metabolism. The thyroid hormone does this by way of stimulating carbohydrates and fat metabolism. So stimulation of carb and fat metabolisms. Also, the thyroid hormone increases BMR. Increase BMR, or basal metabolic rate. Thyroid hormone itself, it decreases concentration of cholesterol. And phospholipids, and also triglyceride. But in turn, it will increase the amount of free fatty acid in your blood. Free fatty acid. And for somebody who has low thyroid hormone, then it will do the opposite. Okay, and fifth one is the effect of thyroid hormone on body system. I'm just gonna go ahead and clear this one, and we'll clear the canvas. And so the first one, the fifth one is on body systems. And on body system, if for example, effect on the heart, it will increase heart rate. It will increase the heart strength. Also, it will increase GI motility. So that's why people with hyperthyroidism will have tend to have variety of diarrhea. It will increase the muscles, vigor. Muscles become more vigor. Increase respiration. The effect on the muscles, actually, when you go back to increase the the muscles react with vigor with the thyroid hormone, with the effect of thyroid hormones. But when the quantity of the hormone becomes excessive, the muscles become weakened because of excess protein catabolism. So yeah, there are two effects on the muscles themselves. And for example, also effect on sleep, because of the exhausting effect of thyroid hormone on the musculature and on the central nervous system. So people with hyperthyroidism often has a feeling of constant tiredness because of the excitable effects of this thyroid hormones at the synapses. So, and then it makes them difficult to sleep. So decreased sleep. And the last one will be the effect on sexual function. Yeah, excessive thyroid hormones, excessive concentration of thyroid hormone will increase actually libido. And if you have low thyroid hormones, most likely the person will have decreased libido, or could be impotence as well. So these are the functions or the effects of thyroid hormones on our body system. Okay, now let's talk about the physiology of thyroid hormone. As I mentioned before, thyroid hormone, their thyroid hormones are secreted by the thyroid glands. So there are two lobules. This is the thyroid gland. This is separated by the isthmus. This is located on the anterior neck. So yeah, below the thyroid cartilage, and if you want to palpate it, it's below the Adam's apple. And the thyroid hormone secretes, the thyroid glands, secretes thyroid hormone. Of course, thyroid hormones, which is T4 and T3. One thing that I want to mention as well is that you need iodine. You need iodine in order for this thyroid glands to produce T4 and T3. So the difference between T4 is that in T4 there are 4 iodine atoms, and in T3 there are 3 iodine atoms. So the T4, the thyroid hormone secrete about 93% of T4 and about 7% of T3. So there's more T4 secreted by the thyroid glands. At the end of the day, after a few days, for example, like 50% of the T4 will become T3. And the cell, all our cells in the body, they only use T3. So even the T4 goes to the cells, even for example, this is in a cell. For example, this is in a cell like this. If there's a T4 coming here, one iodine is going to be taken away, and it's going to be converted to the thyroid triiodothyronine, and then T4 is called thyroxine. So, and T3 will just go. This is free T4 and free T3. The reason why I say it's free T4 and free T3 because most of I would say 99%, as a matter of fact, 99% of all the thyroid hormones are bound to protein, which is the majority of protein is globulin. So they're bound to globulin. So they have to be unbound and become free and then enter the cells. And just only 1% that is free, which is very small percentage. And okay, let's go back to this one. So if this is the hypothalamus, for example. Okay. So this is the hypothalamus. This is the hypothalamus. And this is the pituitary gland. Pituitary gland. So, the hypothalamus secrete what is called TRH, or thyrotropin releasing hormones. The thyrotropin releasing hormone is secreted into the anterior pituitary, which is the frontal portion of the pituitary gland. So thyrotropin releasing hormone stimulates the production of TSH, or thyroid stimulating hormone. And in turn, the TSH stimulates the production of T4 and T3. Okay, so again, thyrotropin releasing hormones secreted by the hypothalamus, and it goes to the anterior pituitary gland to stimulate the production of TSH, or thyroid stimulating hormone. And the TSH stimulates the production of thyroid hormones, which consists of T4 and T3. So this is a constant. This is in order to maintain a normal concentration of T4 and T3 in the body, there's a negative feedback loop mechanism. So what happens is that the body will, let me just use different color. This is, for example, this is the negative feedback loop. I will explain to you a little bit more. So, for example, if the body only senses the free T4 and free T3, okay, it will not sense the bound thyroid hormones. The ones who are bound to globulin, it will not sense that. But if the body senses, for example, if there's an increase in thyroid hormone, for example, T4. If there's an increase in T4, then there's going to be a decrease in the production of TRH and the production of TSH. The pituitary gland will secrete less TSH, so there's not going to be more production of thyroid hormones. It will in turn make the thyroid hormones go back to normal. So if you have increased T4, for example, you will have less TRH and less TSH. Okay, if you have decreased T4, you will have an increased production of TRH and increase production of TSH. I'm sorry, increase production of TSH. So less thyroid hormones, then the body's gonna react to that by increasing the production of this one and this one. So as a result, this TSH will stimulate the production more of the production of thyroid hormones. And as you see, this is a negative feedback loop mechanism, and it's very it happens like daily. And that's why I'm going to talk right now. I think it's better if we go to the conditions of the people with hyper and hypothyroidism. Let's make some. This is the condition. I'm gonna make so let's check. So in when the first thing that healthcare providers will check, if doctors would order a test for thyroid function, they will order a thyroid stimulating hormone test, TSH. Okay, so that's the first thing they're going to do. And then also sometimes it is included in this one is a free T4. They will order exactly the thyroid hormone test itself, which is free T4. So in normal condition, people who don't have any thyroid problems, the TSH will be normal, and the free T4 will be normal as well. In hyperthyroidism, so this is for patients or people who have high thyroid hormone level, and the TSH will be low, and the free T4 will be high because they have hyper. So if they have high thyroid hormones, the body will make less of TSH, that's why it's low. So hypothyroidism, the body will have low T4 but high TSH. It's the opposite. So this is primary, I would say primary hypothyroidism. Okay, primary hypothyroidism is the problem is at the thyroid gland. The problem is at the thyroid gland itself. This is the problem. That's the primary. Okay, and secondary hypothyroidism, that's a little bit tricky because it's hypothyroidism, so the T4 will be low, but the TSH also because is going to be low. And the problem itself is not because of the thyroid gland is unresponsive, but because of there's a problem here. There's a problem in the pituitary gland right here. I would like to mention also, let me just go back. I would like to mention that the negative feedback loop mechanism, yes, it's true, the thyroid hormones will have an effect on the pituitary gland and TRH, but mostly pituitary gland. If you cut this off, if the stalk is cut off, there's still going to be stimulation. The negative loop feedback mechanism is still going to happen. Okay, so let's go back to secondary hypothyroidism. The problem is not because of the unresponsive or a decreased response in thyroid gland, but rather in the pituitary gland. So because it's hypothyroidism, so it's low thyroid hormone level. But in primary hypothyroidism, the body will secrete more of TSH. But in secondary hypothyroidism, the body also has low TSH level because this thing doesn't work. So the pituitary gland does not respond to low T4 or low T3, and therefore you have free T4 is low, and when you do the test, the lab, the free T4 is low and the TSH is low. Okay, I hope you guys are following up to this, and we're going to talk about conditions of hyper and hypothyroidism and the treatments and what the treatments are in the next canvas. Thank you guys for watching, and I hope you enjoy this video. I also do hope that this video will help you in your studies to pursue a career in nursing. If you guys have a request about any other topics in nursing, leave a comment below. And if you guys share or like this video or subscribe to my channel, it will help me tremendously to create more of these videos. Well, I'll see you guys till next time. Bye.